Hi, my name's Cameron. I'm trans non-binary. I'm 26 years old and I currently live in Stafford. I just wanted to put together a little resource for trans non-binary people that are wanting to access hormones. One way to do that is through the London Transgender Clinic on Wimpole Street, which is how I get my testosterone. I knew I wanted to start taking testosterone shortly after I had my top surgery. I had a bilateral mastectomy in October 2020 with Chris Inglefield at LTC. I just wanted my body to accurately reflect who I was on the inside. So after top surgery, my body naturally just looked more masculine and I just didn't want to stop. So I got in touch with LTC to see if they would be able to prescribe me hormones, and thankfully they were able to. When I first started taking testosterone, I was on a quarter of one pump. I wanted to microdose. Obviously being trans non-binary, I just wanted to control the physical attributes of taking testosterone as much as possible. At the time, I didn't know exactly what physical features I wanted from taking testosterone, so I thought it best just to ease in, and that just made sense for me. And about 2 months into my hormone journey, I decided to just up my dose to a normal dose. So I now take 2 pumps of Testogel. The Testogel comes in a bottle like this. I think it's an ethanol based gel that you just literally one pump on this arm, one pump on this arm. And that's just me personally anyway. You can obviously put it on any soft tissue area on your body, but predominantly I think it does go on your arms. So just one pump on each arm in the morning. I put mine on at 10:30. And try and keep it the same every day, just so there's a consistent level of testosterone in your body kind of around the clock. That seems to work, and I think that is what's recommended by LTC. Fortunately, after top surgery, I was able to use my psychological evaluation with my gender specialist as the initial document for getting hormones. You do need a evaluation from a gender specialist just to confirm that you do have gender dysphoria, and that just acts almost as like a green card in order to access hormones with LTC, just so there is a document that we can all rely on that does prove that you are in a good state of mind and that this is a healthy decision for you to be making at this stage. There are a number of psychiatrists that work with LTC. I emailed reception, they just gave me a few names that are linked with the clinic, which was really useful. So I ended up going with Vicky Petersky, who had quite a short waiting time and wasn't that expensive, so that worked well for me. What happens then is I had some bloods taken before my appointment. I had my bloods taken with my local GP, who will then screen for things like liver test function, my pre-hormone testosterone levels, estrogen levels, liver function. Then from there, that's reviewed. And when I went to my initial consultation with my endocrinologist at LTC, Lucy, your levels are reviewed, and then if everything seems okay, she usually then issues the prescription that day. Last week I had my 6-month review. LTC you get reviewed every 6 months. I had a Zoom consultation with Lucy, my endocrinologist. She went through all of my blood results and all my levels seemed fine. So moving forward, we agreed in that meeting that I will, instead of gel, moving forward I'll be using Nebido, which is an injectable form of testosterone. It will go in incision into my bum. What usually will happen, I think, is again the NHS will prescribe the testosterone, but because it's an injection I'll have to go to my GP for them to administer it, which is obviously fine by me because I would rather a healthcare professional be delivering it instead of me trying to stick a needle in my bum or get my girlfriend to do it. For me, this choice of Nebido makes sense. It's not for everyone, but for me personally, it's definitely the right choice, especially because I'm dating a trans feminine person. And obviously she is trying to reduce the amount of testosterone she produces, so to then it can be transferable, the Testogel, so we do have to be careful. So in the mornings I'll have to put it on, wait 5 minutes and then put a t-shirt on, So to be able to negate that possibility of transferring the testosterone is definitely going to be worthwhile, I think, for me. There is kind of rumours about that Nebido and injectable testosterone works better and faster for transmasculine people. I'm not entirely sure if that's true, but I will definitely let you know. But it is my understanding that they do work exactly the same. I mean, as I said, I've been on it for 6 months and I've already got some physical attributes that I wanted. So as you can tell, my voice has dropped, which is great. Aside from when I'm in the car singing Ariana Grande, I can't quite reach that high note anymore, which is a bit sad. But I'm really happy with how my voice is dropping, because it was quite high before. I also would like a slightly more masculine jawline, which is happening, it is coming through. I'm also growing a very small moustache. I'm hoping to grow a full one imminently. The other physical changes that I noticed whilst taking testosterone were I had bottom growth. A lot of people kind of don't really like to discuss this, or there's not a lot of information about it. It's basically just when your clitoris grows. It's as simple as that. It's not that much of a big deal, I think. Understandably, people can be quite shy when discussing it, but I'm kind of like an open book, so yeah, that happened. And I'm also getting hairy as well, which is fine for me. I don't know if testosterone, I don't know if I'm going to be on it forever. I like that as a non-binary person, I'm very in the middle, obviously, of the gender spectrum, which is where I like to sit and where I've always kind of sat in regards to the spectrum. And I think it just helps me feel more confident when I walk down the street or when I'm in the shop and I open my mouth and I'm not the chances of me being misgendered or referred to as she is significantly reduced after taking testosterone, for sure. I can't quite believe how quickly the changes did actually come, especially between 2 months and 6 months. I just feel like my whole body type has changed. I'm aware that I've got a bit further to go. I would like to build my shoulders a bit more, just to give the illusion of a smaller waist. But generally, I feel physically very, very different. And I definitely wouldn't have been able to have done this if I was with the NHS. As we all know, I'd have been waiting 4 years, which just wasn't feasible for me. I'm very grateful that I had the option to go private with LTC. And I highly, highly recommend the level of care that I received. If anybody has any questions or if anyone just wants any further information, feel free to reach out, and you can get me on Instagram at Cameron_SBX. Thanks.